Hey there, and welcome to the Dr. Medicape YouTube channel, where we make medicine simple. In today's video, we're covering a topic that's not often asked in your exams but might still pop up, which is plague. So, today we'll be covering the epidemiology, the types, the virulence factors in the lab diagnosis. And this question may pop up as like a short note on the rat flea, for example. So, once you cover these three topics, you'll be able to write about it. So let's get started. So the first thing that should come to your mind when you hear the word plague is this dude. Okay, I'm gonna try to make a drawing over here. You've got a rat, or this is supposed to be a rat. So basically, we know that like cockroaches, and mice and rats, what are they? They're pests. And just from this, we can remember that the causative agent of plague is Yersinia pestis. Okay, so plague can be defined as a fulminant systemic zoonosis caused by the bacterium Yersinia pestis. Now, what is the meaning of fulminant? Fulminant means a disease that spreads rapidly and very aggressively. Systemic means it affects multiple body systems, and zoonosis means it's a disease transmitted from animals to humans. As you may see over here, the infamous plague doctor. Basically, these guys, back in the day, before science-backed treatments, they did their best to control the plague with the limited knowledge they had. And just like it caused like a pandemic in England, there were other pandemics, and we'll be diving into all of them also today in a little detail. So as we already know, the causative agent for plague is Yersinia pestis, and the reservoir are wild rodents or other mammals. Basic reservoirs where this Yersinia pestis resides. So, how does the transmission of plague exactly occur? Basically, there are three main methods in which it can occur. First, it can occur through a bite from a vector, which in this case is the rat flea. These suck blood from rats and may also bite the human. So when basically this bites the human, then there's the transfer of the Yersinia pestis into the human, and then it spreads to local lymphatics, which we will be discussing basically the pathophysiology later. For now, there are three main methods of transmission. One is the bite from the rat flea, which is the most common vector. Okay, this is a very important point. Secondly is direct contact with the infected animal, or like the tissues of an infected animal. A person maybe who deal with these rats, they could have also contracted plague. And the third one is, which is kind of uncommon, it occurs, is droplet inhalation, which is from man to man. Moving on to the major plague pandemics that took place, we know the first pandemic, it took place in around AD 541 at the time of a Roman emperor known as Justinian. Okay, the second plague pandemic took, which was called the Black Death, and we'll know why it was called the Black Death a bit later in the video. It occurred around the 14th century, and this was a horrible plague. It wiped out literally 1/3 of the European population. It was a disaster. The third pandemic, we know it took place in Hong Kong in 1894, and after this there were a few cases that even came to India, like after the 1900s. Those are not that important to remember for the exams, but if you like write this much, it is like enough to at least impress the examiner, I would say. Moving on to the clinical types of plague. There are basically three main types of plague. Either we have the bubonic plague, the pneumonic plague, or the septicemic plague. So I'm going to make this really easy for you. Bubonic, once you hear the word bubonic, just remember the word buboes. And when you hear the word septicemic, matlab there's like a very bad septicemia, it's related to infection. Once you hear septicemic, remember it's related to a very bad infection, and just envision a person with massive hemorrhages in their basically blood vessels. Anyways, let's go over them one by one. Bubonic plague, as we already studied before, it is transmitted through the vector, which is the bite from the rat flea, which is its primary vector. So what happens is that basically the bacilli, after you've been bitten by the vector, the rat flea, the bacilli, they travel to first the local lymphatics, and after that they travel to the regional lymph nodes. So in the regional lymph nodes, basically the bacilli get locked up in buboes. And how do the regional lymph nodes now present to us? The regional lymph nodes will present as tense, tender swellings known as buboes. And the most common site where we see these buboes or these tense, tender swellings is the inguinal site. So if you basically palpate a patient's inguinal lymph nodes, you're likely to see these buboes. However, they may also occur at other sites. Keep this in mind, for example, axillary, and so on and so forth. In the second type, we have the pneumonic plague. The pneumonic plague, sorry. So basically, pneumonic plague is transmitted by inhalation of the droplets. That was the third method we learned. Basically, how plague is transmitted through droplet inhalation. So obviously, this pneumonic related to lungs is going to be transmitted by this droplet inhalation from man to man. So after this inhalation of these droplets, we see basically an onset of some symptoms. And here's an important point. It's very, very rare to occur. There's less than 1% chance of this pneumonic plague occurring. However, if it does occur, it is very, very fatal with basically a fatality rate of around 30 to 100% if left untreated. So even though it's very rare, it is very, very fatal if you contract it, and therefore it could be used as an agent of bioterrorism. Coming to the third type, which is the septicemic type. So the septicemic type, primary infections are rare, very rare. Like they occur through, for example, there's a transport of a specimen and you don't take care, so they're accidentally laboratory infections. But the secondary infection is very, very dangerous of this, and it is the more common type. So in this infection, what happens is that there's a massive involvement of the blood vessels, and this causes basically the hemorrhages under the skin and the mucosa. And when these hemorrhages occur, there may be the formation of a gangrene. And we've all studied in patho and also earlier chapters that we have studied about gas gangrene. So from this idea, you can always remember that it is the cause of Black Death. Finally, coming to the most important thing, if you don't know anything, at least remember this, that is the lab diagnosis of plague. So basically, for every lab diagnosis, the first step we know is specimen collection. So how do we collect the specimen? It depends on the type of plague. If it's bubonic, then we basically take the aspirate from the buboes. If it's pneumonic, then sputum and blood. And if it's septicemic, so then we take blood or the splenic aspirate. S for septicemic, S for splenic. And obviously the splenic aspirate is post-mortem. Matlab the patient is already dead, then we take this aspirate to just confirm what was the causative agent exactly for the death. Transport medium is a Carey-Blair medium. Then when we do direct microscopy, what do we see? We do two types of direct microscopy, Gram stain and Wiesen's stain. In Gram stain, we see obviously the pus cells, and we see Gram negative oval cocobacilli. Wiesen's stain, we see bipolar or safety pin appearance. Then in the blood culture, in blood agar, we see dark brown pigmented non-hemolytic colonies, while in the McConkey agar, we see lactose non-fermenting and colorless. So basically, blood agar, we have non-hemolytic and dark brown pigmented. McConkey agar, we have colorless and non-fermenting. And finally, coming to the next one, we have identification. Identification is pretty easy. We all know that uh, the common things, for example, Malditoff and the ICU-T tests, indole, citrate, urease, and TSI test. So, very easy way. This is very easy for us. Indole is negative, citrate is negative, urease is negative, and even the TSI test, basically it's an alkaline by acid slant. The gas is absent, H2S absent. Plague is really easy. Almost everything is, kind of absent. Like we see H2S absent, gas absent, alkaline by acid. All of these are negative. Then we have colorless, we have non-hemolytic, we have non-fermenting. So it's not much of an issue. Finally, one important also way to identify is through antigens and antibodies. We know this from our previous microbiology lectures. So in plague, we have the F1 antigen detection. I like to remember this like this is how I remembered it, at least. Like rats, they have fur on their body. So F1 antigen. That's how I remembered it. So there's the F1 antigen detection, which we can detect through direct immunofluorescence test, ELISA or ICT. And then the antibodies that are produced to this F1 antigen, we also detect them through ELISA and passive agglutination. Next, we come to the molecular methods, which are PCR, and what we target, we either target the genes coding this F1 antigen, which is the virulence factor, or the pesticin gene. Again, pest came. So let's talk a bit about this F1 antigen in case they ask you about the virulence factor. So this F1 antigen, it is it's a capsular protein antigen encoded by a plasmid. Plasmid, we already know what it is. It's a circular piece of DNA in the bacteria. So basically, this virulence factor, which is the F1 antigen, is encoded by the capsular protein antigen, which is encoded by a plasmid. And how is its mechanism of action? Its mechanism of action, which makes it virulent, is it inhibits the phagocytosis by macrophages. There's no phagocytosis, so the bacilli remain in the body, they multiply, they do whatever they need to do, and basically they cause the disease to occur in the human. So that's all we really have for plague. So let's just go over it one more time. The definition was it was a fulminant systemic zoonosis. Zoonosis means animal to man, as it's by the rat flea. So it's a pest. So the bacterium is Yersinia pestis. Then we had basically the plague doctor. Then we had the causative agent, which is Yersinia pestis. And the reservoir for this were wild rodents or other mammals. Transmission was through three ways. So the bite from the rat flea, which is the most common vector. It causes basically bubonic plague. Then we have direct contact from the infected animal tissues. And lastly, the droplet inhalation causing pneumonic. The pandemics, we had the first, the second, and the third. The second one was a Black Death, killed 1/3 of the European population. Then we had three clinical subtypes: the bubonic, pneumonic, and septicemic. Septicemic, there were massive hemorrhages, therefore under the skin, therefore it was called the Black Death. The formation of gangrene also in septicemic. And in bubonic, we had the formation of the buboes, where their most common site was the inguinal lymph nodes. Okay, and pneumonic, we know it's related to lungs, so obviously inhalation, and it's very rare. However, both septicemic and pneumonic could be used as basically agents of bioterrorism. Lastly, we had the lab diagnosis, which depended on the type of plague, the specimen collection for it, very simple. The transport medium, the Carey-Blair medium. Direct microscopy, we saw gram negative plus pus cells, and Wason stain, we saw bipolar or the safety pin appearance. Culture, we saw blood agar, everything is negative basically. It's non-hemolytic, it's dark brown pigmented. Then we have McConkey agar, in this everything is also negative, non-fermenting, colorless. Identification, we had Malditoff ICUT tests were all negative basically. And lastly, the third way we could detect was either the F1 antigen, which was the capsular protein antigen encoded by a plasmid, which is its virulence factor, through the different methods, or we could also detect the antibodies formed to this F1 antigen. Molecular methods were PCR, that targeted again this F1 antigen, or the pesticin gene. So that's all for today. I hope I made this topic a bit easy for you, and it really only takes 5 to 10 minutes to learn this topic. We say, as I mentioned before, it's a miscellaneous topic. It may or may not come in your exams, but it's good to have a go through this topic, and it really doesn't take much time. Just watching this video once, I'm sure you already remembered it through pests and fur and so on. So thank you for watching, and I'll see you in the next video.